Hi, I'm Dr. Kim Musinski, and along with Dr. Scott Musinski and our team, we thank you for taking a few moments to learn more about us and how we've been able to help people for over 3 decades with a variety of health conditions. Ultimately, it's all about you. If you've been everywhere and gotten nowhere with your health, have seen multiple doctors and are still looking for answers, we can assure you you're in the right place. We have helped a lot of people. This video is so you can get to know a little bit more about us and what's next. These are examples of some of the things we address: gut issues of all kinds, digestive issues, bloating, IBS, including reflux, leaky gut, SIBO, effects of chronic mold and Lyme, and gluten intolerance. Hormones, anything to do with the menstrual cycle and the transition into menopause, infertility, PCOS, lots of baby prep, sleep issues, low energy, thyroid imbalances, anxiety and depression, and this includes methylation issues. Metabolic issues, including diabetes, prediabetes, high cholesterol, put those together, that's metabolic syndrome, weight management and insulin resistance, blood pressure, anemia, pain of all kinds, headaches and migraines. So many people have daily headaches, and that shouldn't be the case. Inflammation and immunity, including food sensitivities, all skin issues, hives, rashes, eczema, psoriasis. Those two are in the autoimmune category. Other autoimmune conditions, including Hashimoto's, lupus and scleroderma, celiac, Crohn's, a variety of conditions that we address and help routinely. So our main purpose is to empower others to be in the driver's seat of their own health and quality of life. So for me, my passion for helping others achieve optimal health stems from my mom's health journey. She suffered with Raynaud's for as long as I can remember, with poor circulation to her fingers, turning all the colors, blue, white, purple, and very, very painful. But worry crept in as it ramped up in her 40s with more issues popping up. I was in high school about this time. She had a butterfly rash on her face every morning, often had trouble swallowing during meals. And along the way, she saw doctors and accumulated meds to address the symptoms. Seeing multiplying meds was concerning, but the alarm red flag for me was raised when one of those medications was to improve circulation because her heart was enlarged due to the extra burden. And we didn't know why. She was never diagnosed. So it wasn't until I was in my clinical phase of my doctorate that my mentors and I fully diagnosed her. There's a screening test, laboratory test called an ANA titer that is used to measure autoimmune activity. And it ranges from a level 1 of about 80 to about a level 5 of 1280. Hers was at the top value, which meant it was highly aggressive. She had both lupus and scleroderma. So those are two of the more serious connective tissue autoimmune diseases that, if not checked, can be fatal. For those who don't know, autoimmune is when the immune system is confused and stuck on high. And instead of attacking and removing foreign cells like it's supposed to do all the time, it attacks our own body's normal tissue. With scleroderma, the body makes more collagen deposits, and it builds up in the connective tissues. So those include muscle, blood vessels, and skin, and makes it less flexible. So eventually it hardens the organs. We began holistic treatments addressing the driving inflammatory factors and concurrently referred her out to a rheumatologist. At that point, being several months later, because that's what it takes to get an appointment, go through the whole routine, the only medical approach that they can offer was infusion to completely suppress the immune system. But she wasn't ready to take that step yet. In fact, she was already feeling more like herself, and her ANA, when we tested it again preliminarily, it's not supposed to come down according to standard medical doctrine, but it had dropped a full level. So we just continued with our therapy. Within a year of her diagnosis, her ANA dropped all the way to 0. So that means full remission. Her circulation improved. She could eat a meal without interruption. She felt like her usual energetic self. And she maintained remission for another 30 years, living a full, vibrant life, and passed just shy of 80. So we considered that time with our mom a true blessing for our family. So our main message is that lifestyle matters. Genes have 20 different expressions and don't need to be turned on at all. And if they are, they don't need to be turned on high. So our health and quality of life is in our hands. So our approach is with functional medicine, and it's a different approach addressing imbalances at the root cause to reverse and prevent the prevention of disease. Our bodies know how to function. We just need to help clear the way. So we partner with you and teach you the necessary tools to optimize and maintain good health. And, we're all frustrated with the healthcare system. Many experience doctor visits where labs look normal, but we don't feel normal. And that's because the regular lab ranges are based on sickness parameters versus the optimal ranges and don't show the full picture. So doctors are frustrated too. First, they're not trained for wellness. They may want to do more, but they're also limited by insurance guidelines and the sick care model. And they don't have time. A typical office is about 7 minutes with a prescription. And then you get into the specialty ring and add more prescriptions at each stop. And then it starts to look like what happened to my mom. So I'm sure this also looks familiar to you, either for yourself or a family member. So our most common question that we get from our patients is, why doesn't my doctor do this? So very simply, traditional medicine and functional medicine are two different disciplines. We do need both. For example, penicillin is one of the most important life-saving discoveries. But we all know that if we take an antibiotic every time we get sick, it messes up the balance of our gut, lowering our immunity, making it easier to get sick, and that creates a vicious cycle. So traditional medicine is geared to critical care with using medicine as a treatment, medical approaches. Functional medicine is geared to addressing root causes and chronic lifestyle-driven imbalances, which, by the way, is behind about 90% of the disease in our society. So I like to use this prism analogy to compare the two. When white light is fractionated, the colors represent the body systems with the corresponding medical specialties addressing them separately. Only when we look at the systems holistically can we see clearly, like the white area there in the middle of the picture on the right. And this prism itself is very simplistic. Actually, our bodies are more like this multifaceted crystal with its very intrinsic complexity. We need to enhance its function and let its very complex natural feedback mechanisms work on their own. And so what is health? As defined by the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Yet, straight from the Medicare Journal, insurance guidelines are as follows. Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary and therefore not payable. So let that sink in. Again, care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary, therefore not payable. So Medicare sets a standard for all insurance companies to follow. And it's kind of similar to auto insurance. Auto insurance, we use that when there's a crisis or crash, right? We don't use it for all the maintenance and repair to keep that car running like a fine-tuned machine. So with our sick care model, there is a lot of wrong or lacking information. We're indoctrinated to use our insurance for healthcare, yet it's really designed to cover sick care with medical treatments, not to optimize health. And the natural healthcare industry, it can be just as bad with misinformation. Like you've all seen the magic, supplement, the one supplement that can cure all, or a device like an ab cruncher that's supposed to give you a magical shortcut to six-pack abs. So we need to look at it in a different way. So is this approach right for you? It could be right for you if you are feeling overwhelmed and exhausted. You're not feeling as good as you know you should. You know you've got to do things differently, but you don't know how. You realize health does not come in a bottle. And you're willing to take responsibility for your health. So how do we get the results that we do? We use an approach that's based on 5 pillars. And those are detox, nutrition, hormones, fitness, including nervous system, and mentoring. So we're going to break those down a little bit, starting with detox. Gut health is foundational, as it does house 80% of our immune system. So overall, we need to eat the right food, digest it, absorb it, utilize those nutrients, right? And then eliminate the waste. We have to continually clear toxins, as a backup does create issues. So in our office, we routinely do detox programs, and they're helpful even if you've done them before. And don't worry, it's easy to do, and you're not tied to the bathroom. So next is nutrition. And again, we need to eat real food, right? And we need to make sure that it's the right food for us, as there's many things in our food source, and there's a lot of inflammation. We routinely also pinpoint specific inflammatory foods that can interfere with digestion, which over the time alters our biochemistry, basically. So the purpose of food here is to sustain life and provide energy and promote the growth and repair of tissues. So next is fitness. And we all know we need to move. Motion is the lotion. It's good for our health. We do realize that some of you may not feel well enough to exercise, and no worries, we meet you where you are. Along with the structural, nervous system balance is very important, as nerves control our entire body. So we can, and that's our function. So we can compare this diagram to, say, the electrical box in our house. We need the main breaker and all the fuses engaged to allow electricity to flow throughout. Hormone balance is the next, and I do stress balance. Hormones are our most sophisticated biofeedback balancing act our body maintains. We have to think about that when considering how any hormone replacement may affect that balance. So hormones include estrogen and all the sex hormones, adrenal and all the stress hormones, thyroid and liver, and neurotransmitters fall into this category as well. So that affects sleep and affects anxiety and depression. Weight is especially dependent on hormone balance. This is just a snapshot of hormones involved in fat burning and storing. So our favorite scenario is when excess weight just falls off when normal function is restored. But we do help also with stubborn weight loss and insulin resistance. So the right labs, that's next. We don't guess, we test. I like to say our functional medicine labs are like looking under the hood and then looking under that hood. So with our approach, we determine where you are and provide a bridge to where you want to be, and we help walk that path with you, which brings us to one of our most important pillars, which is mentoring. So we guide you all the way. We determine the underlying cause. We create a unique plan for you. We educate and empower you, very important, and then guide you through that journey with accountability and coaching, encouragement, celebration. We provide custom all-inclusive programs, and we put all these things together, right? So we put together the right lab testing, the right supplements, the necessary knowledge. We do all the check-ins and support, and we put all these things together in a comprehensive plan so we can get you on your way to good health. So I want you to think about this. Which of these pillars can we leave out and still be successful? So I hope you realize we can't leave any of them out. And that's the secret. That's how we help so many people turn their health around and improve their chronic conditions. We put a full plan together, address all these components together, because when we try to do it piecemeal, that's where 90% fail. We need all these components working together. So this quote sums it up pretty well. Tell me, and I may remember. Show me, and I will remember. Involve me, and I will understand. So what's the catch? So we need to put in the work. This dog here is reaping the benefits of his walk, but the owner not so much. So then what's next? All right, we've most likely talked to you at this point. What's next is that you will meet with either myself or Dr. Scott for our initial consultation, and we'll do your full wellness evaluation then. If you don't have an appointment reserved, go ahead and give a call or email the front desk to set that up. This visit is our chance to get the full picture and our initial direction. So a couple things needed for prep for that visit. If you haven't already, go ahead and sign into the patient portal, fill out the questionnaire and the forms in full as soon as possible, but no later than 24 hours in advance so that we can do our homework and make the most of our time together. Please be on time. We do run an on-time clinic, and your appointment is reserved as dedicated one-on-one time. For virtual visits, same as the above, just make sure you're in a stationary, quiet space with Zoom capability and a good connection. We work with patients virtually within the contiguous US. However, we do recommend you come in person to your initial visit if you're local. So, if this proactive approach to take your health into your own hands resonates with you, it can be your true transfer change. Thank you so much for watching. I hope you learned a lot about us. And on behalf of our team, we're excited to get to know more about you and seeing you soon. Thanks.